Hello and welcome for session 1. So before we get into the exercises, I'll quickly just want to cover something for you. So the fact that your tissue is quite lax does matter, but it doesn't matter as much as you probably think it does. So Heather has EDS before she flew over to Norway to obviously do her treatment with me and then do her training with me to then take over the Newcastle studio. She was very hypermobile and was prone to a lot of subluxations and dislocations. However, she hasn't subluxed since, which is a little bit of an issue for us right now because we really need her to be able to hyperextend her knees, which is something she can't do. So we might have to use a little bit of imagination. So if you load your weight onto your right leg, Heather, that's it. So what happens with somebody who isn't hypermobile is when the leg comes backwards, specialist nerves, things like proprioceptors, inform the spinal cord and the brain where the joint is in space and time, and your brain can essentially lock the joint using big superficial muscles. However, in those with hypermobility and hyperlaxity, what happens is because skin is a very big kind of conductor for proprioception for letting your brain know where joints are, and because the thing that is affected in hypermobility is collagen, obviously some people are going to be hypermobile, shallow joints, but that's not what we're talking about. What happens is they don't get a lot of feedback to the brain. So what happens is where this primary braking system of muscle should happen, it doesn't happen, and it just lets the leg hyperextend backwards into a position it's not supposed to be until eventually it bounces off, just relax Heather, until it bounces off your secondary braking system, ligaments. So if somebody isn't hypermobile and they're playing football, what happens is every time their leg goes back, it will lock into the right position. If they get tackled quite hard in the knee, then that movement is going to be far quicker than the brain can send the information, send the output out to lock the joint. So what will happen is it will go back into hyperextension until it bounces off ligaments, your secondary braking system. So with hypermobility, what you'll find is that there's a lot of people out there where if you tape the knees up, they will find that they will be much more stable in the knees. Keep in mind that kinesiology tape is really flimsy. So that isn't going to be enough to create a massive amount of support in the knee, but what it will do is irritate the skin, irritate the nerves in the skin, and send information to the brain in the form of what we call a tactile cue to let the brain know where the joint is in space and time, which makes it a lot easier to stabilize the joint. However, if you're wearing tape all day, eventually you will desensitize to that. The nerves will become quieter and then you'll start subluxing again. The same as if Heather put a watch on this morning. It'll irritate her for a little bit, but eventually the brain will stop listening and it'll tell the nerves to relax and be quiet until eventually she doesn't even realize that she's got the watch on. So in the weeks to come, we're going to be doing a lot of tactile cue kind of work for hypermobility. But seeing as this is our first session, we need to go a little bit easier. And what we're going to do is we're going to focus on things like isometrics. Now, isometric work is basically the safest exercise you can do because no joints are moving. And if no joints are moving, then you can't sublux and you can't dislocate. We also know that isometric exercises are have a really good analgesic effect, i.e. a painkiller, which is fantastic. The mechanism isn't completely understood, but if you ask me, it's probably due to the fact that most isometric exercises, all of them, are stress positions, which is going to mean Heather's going to have to produce a lot of endorphins to help kill the pain and keep it going through. So let's get started. Muscles work together, which means for you to open a door, you need your bicep, you need your lats, you need connection through the thoracolumbar fascia into your left bum, you need the big toe on your left foot, all to help rotate you through. Muscles sit in pockets of fascia that helps the body integrate as one unit. So going forward, we really don't want to be focusing on just working one muscle because really that isn't how bodies work. And if we're trying to get you to restore your movement patterns, stop your joints dislocating, we need to use the body how it's actually meant to be used. So our first starting exercise is an isometric, which will help to give you a nice painkilling effect from it, helps you to start loading the joint, and more importantly, it starts to help your brain kind of understand where that joint is in space and time. The better you get at this exercise, because it's specifically for your ankles, knees, and hips, and it helps them integrate together, the quicker your joints will stop subluxing, really. So let's get to it. So you want to be stand up nice and tall. You want to place your hands into this position. And then what you're going to do is you're going to ensure that your toe we'll start with the left side. So your left toe is going to push into the floor, not massively, just enough to pull a little bit of an arch here in the foot. So if you've got flat feet, this is a good exercise. So make sure you've got a little bit of pressure pushing through the big toe on the left foot. I want you to try and put about 70-80% of your weight onto your left foot. Now, so keep this position here, lock it in place. Moving up to the knee, we're going to soften the knee just a tiny bit. So we don't want to be too bent and we don't want to be locked and we don't want to be just soft a tiny bit. Try and keep this joint. It will collapse down and you'll end up or trying to straighten your leg. Try and avoid doing that if you can. So, big toe down, arches up, weights shifting to the outside of the foot, knees bent, and it's locked into place in a bent position. Now this is the important bit. You're going to straighten this right leg, and you're going to hike this right hip up. If this is a little bit too hard or your balance isn't too great, you can put just the toes of the right foot down. Okay, so you've got a gap underneath your heel in the floor. If you're okay with that, what you can do is just lift the foot up. Now, you're going to have to really make sure that the ankle is nice and locked, arches in the foot, and more importantly, knee is bent and locked in that bent position. Make sure the hip is up, and you will try and cheat this, so what you'll probably do is start bending this leg so that you can drop this hip. Try and avoid doing that. And what we're going to do is we're going to try and get a minute and a half in this position on the left foot, okay? Depending on your own mechanics, what will happen is you'll either get a big burning sensation in this glute med as this is contracting to hike this hip up, okay? That's where about 80% of people will feel it. Or you're going to get a little bit of burn through the quad, possibly down the outside of the calf, and a lot of people are going to start to get burning in the arch of the foot if they're flat-footed, but this is fine. Remember, pain doesn't mean damage. We're in a very, very safe position for exercise, so please don't worry too much about it. As long as you don't move, there is no risk in this one. So, once you've done that side, you're going to relax, and you're going to spin around, or head will spin around even, and what you're going to do is the other side. So we'll show you from the side angle this time. So, head, she grips the floor just gently. That will help a little bit as well. 78% of her weight goes onto the right foot. Knee bends ever so slightly, she holds it in place. Left hip hikes up a little bit, that's it. She keeps that left leg nice and straight. So what happens if you notice head is pushing her leg further forward? Because that's cheating. And we don't like cheating too much, so we're just going to push it back a tiny bit. And try and keep nice and tall, guys. Again, so we're going to hold it for the same amount of time. Remember, you will try and cheat this, it's perfectly normal. You might not get to the full amount of time. However, just do the best you can. We will revisit this at some point and you'll be amazed at how much better at it you are. So, this is, the reason I like exercises like this is basically, just relax header, because it gets you used to using your body in the environment we're in. So, a lot of people can try exercise in things like hydrotherapy pools. However, if you're hypermobile, it means that basically that 39-degree water is going to vasodilate your blood vessels in your legs. Your blood's going to pool and you're going to get very dizzy and you're either going to pass out or feel like shit, basically. Also, we have a thing called gravity, which means that when we're walking about, we're constantly fighting it. In the pool, that becomes much less. So people can do more when they're in there, but once they're out, that's where the benefit stops. Where things like this gets you integrating your body the way it's supposed to be used, and more importantly, using it with gravity, getting the muscles stronger so they can pump more blood around, getting the vessels stronger so they can pump more blood around, and just getting the whole unit kind of up. That's what we really want. So please move on to the next one. Okay, so this exercise is going to be a lot similar to the last one we've just done. So we're going to get into the same position. So we'll start with the left leg first. So hands together, left big toe pushing down into the floor, 78% of the weight to the left foot, right hip up, knee on the left side bent slightly. Okay, should probably still be a bit burning off the last one. So what we're going to do now is add a little bit of movement with the left leg in to create a bit of instability on the left side and get you used to fighting it. Because it's fine being static and strong. However, if you're not able to fight against external forces, then your balance is going to get affected. So if you turn around, Heather, please, we're showing from the outside. So you're going to get in your position. This is very important. Keep the right leg nice and straight and point your toes up. That'll stop you from bending your leg. And then we're going to ensure that we don't lean forward, not yet, but we're going to let the right leg go back. So you want to make sure you squeeze your bum on the right cheek and then relax and come down. A lot of you won't be able to connect properly and squeeze it, but that will come with time, so don't worry. So, as you can see, Hedda is going front to back. She's bringing it in, she's giving it 2 or 3 seconds at the top, really focusing on squeezing this, really focusing on not straightening this leg, because that's going to be one of the hardest parts to this. Okay, I'm going to start off trying to get 40 repetitions of this. Okay, you can hold on to something if you need to, if your balance is a little bit bad, but really try not to, okay? So, once we've done it on this side, we're going to swap to the other side. Thanks, Hedda. So yeah, same amount of repetitions, up and down. Perfect, keep it nice and straight. Really focusing on keeping the arch in that right foot. Remember, body works as a unit, so you've got to get used to using all of these tissues together. And to do that is quite hard. I will say one thing, when you're doing it, to try and get a bit more stability, you will hold your breath, just like Hedda's been doing this whole time. So please remember, breathe. If you focus on breathing out, you will automatically breathe in, which will help you massively. Just call it a little subroutine of being a human. So, once you've done your reps, relax. Shake off, give yourself about 2.5 minutes to 3 minutes to just let your body relax a little bit, because it might be a bit stiff and achy, and then we're going to assume the same position. So if you get into the position, Hedda, that's it. So we'll do the left side this time. Big toe push down, 78% of the weight to the left, knee slightly bent, right hip up. This time, in this position, we're going to lean forward, and we're going to increase the bend in the left knee just a tiny bit, and we're holding there. That's perfect. Now, if you see how Hedda's done it, her head is perfectly aligned with her foot. So she's got a nice straight line going down here. This is the position you want to be in, okay? Now, she's going to do the same exercise again, but with this slight lean, and this slight lean makes it a little bit harder. So she's going to bring the right leg through, but she's going to steer in this bent over position. That's it. Perfect. Remember, when you're doing it, the leg that's moving, squeeze that bum cheek. Give it a good squeeze. What we're going to try and get is just 20 to 30 repetitions. That's it. So, quick points to note. Big toes pushed in, arch in the foot, 78% of the weight onto this side. Knee is a little bit further bent than it was in the last few exercises, but it's locked in that place. Right hip is hiked. What will happen is, if you drop your hip a little bit, Hedda, what will happen is a foot will hit the floor. So that's a good indicator that you're not doing it right. So if that does happen, you need to lift this right hip a little bit more to get this left hip here contracting. Because when this hip on the left-hand side of Hedda contracts, it lifts her right hip. Perfect. So 20 to 30 of them, then you're going to relax and you're going to do the opposite side. Once you've done that, relax. Give yourself 2 or 3 minutes to relax. Hey, why not 5 minutes? Grab a drink and then straight into the next exercise. This next exercise is meant for ankle stability. So, you're going to need a few things to do this. You're going to need your shoes on for one, because we don't want to be doing this in bare feet, because if you're super hypermobile, good chance of subluxing toes, something I've learned quite a lot about for many years until they started to stop. You're also going to need your light resistance band, and we need to get in a setup which is similar to this, okay? So, use something like a chair leg for a couch or a sofa. If it's got legs, you can get somebody to help tie it round, or you can attach it to the bottom of a door if you've got a stopper. You just need to be able to set up this kind of setup, or have somebody just hold it in front of you. Now, you need to be in this position. So your left leg's folded in and you're relaxed, your right leg's straight. We need to avoid any kind of hyperextension of the knee of the leg that we're using. So if you do have big legs, what will happen is you will be a little bit higher and you'll be able to hyperextend more. So if that is the case, just roll a towel up or stick a cushion, just something underneath it to stop it hyperextending. But what we need is that joint straight, but not in a hyperextended state. So now we're in this position, your band is going around your toes. We need a decent amount of resistance on the band, but not too much, but not too little that we can't feel anything. So you're going to have to really, really gauge it. If it's so So if it's got so much resistance that you physically can't pull it, it's too heavy. So you'll have to come in a little bit closer to it, or if it's too light, move backwards. So it's going to go around your foot, just beneath the toes, and you're going to keep your foot in this position. Now this is the important bit. If you have really hypermobile ankles, then what I need you to do is to just hold it as an isometric. So we'll pull them back and we're just keeping it there, ensuring we don't bend the knee. Not yet. Okay, so legs straight, we're pulling right back as far as we can go, and we're just holding. Okay, you're going to hold it for as long as you can if you have really hypermobile ankles, until it starts to burn, and it will start to burn up what we call the tibialis anterior. Okay, it helps with things like dorsiflexion and inversion. So try and hold it as long as you can until it starts to burn. Is it burning, Heather? Are you all right? Yeah, you're a hard case, so it's probably not hurting you. For everybody else whose ankles are a little bit hypermobile, but not massively, we can start to do a little bit of range of movement work. So what we're going to do is gently just let the foot go forward, controlled, and then we're going to contract it back up and hold. A couple of seconds, then we'll relax and then we're going down. In muscle, you have 3 phases of contraction, okay, or kind of how it works basically. So we have, if this is Heather's tibialis anterior, it is shortened now because it's contracting. So if you relax it down, Heather, thank you. If you bring it in, so it's shortening, this is what we call concentric. Now she's holding it, as in one of the first videos we did for this session. And then as she slowly lets it go down, it's what we call the eccentric, or the negative, you might know it as. Now, out of the 3 movements, you were the strongest in the negative, okay? So if you are super hypermobile, it makes a lot of sense that you do your exercise ranges really focusing on the negative, so really slowly letting the foot go, contraction, and then really slowly, okay? This will help us progress a little bit quicker than if we were just doing traditional kind of focusing on just contracting muscles, okay? So if you are okay to do this, we're going to aim for super high reps. I'm talking 50 to 60 reps on just this one ankle. Okay, so go on, Heather, blast them out, 60. What? I'm joking, I won't make you do them all. Yeah, so we want 50 to 60 reps on this leg, and then you're going to swap to the other side. Okay? If you need to pause the video now so that you can get that done. And then as soon as you've done it, unpause it, and let's get started with the next bit. So I'm going to assume that you have completed them on both sides. This time we're going to put the band back on the right leg where we originally started. And what we're going to do is take the foot all the way forward. Keep going as far as you can get. Hold it there. Now, don't go into the full range of what you're, so most people with hypermobility look like they could be really good ballet dancers because they can really get good at getting on point in the foot position. So we want to go, so we're just pretty much flush, okay? So we're not, can you hyperextend anymore, Heather? Yeah, so that would be too far. We want to come up just a little bit more so that we're just flush. And we're going to work in this end range motion. If you do go any further, the band's probably going to fly off, so you know you're going a little bit too far. And what we're going to do is we're just going to quarter rep it. So we're going to come up, we're going to hold it, then we're going to let it go back down. And we're going to tire it out through about 3 ranges of motion. So we're going to start off by trying to do 20. So we'll do them with you. So you ready? So we go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Hold. See how my fingers come a little bit further up. And we're going to do another 20. 1, that's it. 2, 3, so we're not going 4 all the way back. 5, 6, 7, 8, 9, 10. Last 10. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax, hold, keep it there. A little bit further back. Let's go. 1, 2, 3. It's going to be hard. 4, 5, 6, 7, 8, 9, 10. 1, 2. Come on, in 3, 4, 5, 6, 7, 8, 9, 10. Relax. Good. So you might have noticed while you were doing that you'd be using your knee joint as well. So technically that's cheating, and I'm pretty sure you at home watching have also cheated. What I'd like you to do is to quickly do the left hand side, okay? And then we're going to give it one more go, but really concentrating on keeping that knee nice and straight. not letting it move. Okay, so if we quickly get those repetitions done on the other side, and we'll move on to the next exercise. So I'm hoping you've done them on the other side and we're ready to crack on now. So we're gonna reband up. So we'll be back on the right leg now. Now, we're just gonna do full range of motion for this one. So we're gonna go down far but not in a hyperextended range, just nice and flush. I'm going to put my hand there on headers, or you at home guys, what I'd want you to do is to just put your hand there, just gently put a little bit of pressure just above the kneecap, not on the kneecap, not below it, just a little bit of pressure, and we're just going to do 20 reps all the way up. 1, 2, 3, good stuff. 4, it's probably burning a lot. 5, yeah. 6, 7, go on, 8, 9, 10, last 10, here we go, 10, 9, 8, 7, 6, 5, gets really hard, 3, 2, one more, 1, relax. There's a good chance doing that you've completely fatigued the muscle out and couldn't even get those last 10. That's fine. In the next couple of weeks, you're going to get a lot stronger. A really good thing to know is that when you start any kind of new training plan or any kind of exercise or basically anything, what happens is the first 6 months of that are what we call neural adaptation. You don't really put hardly any muscle mass on. It's about your brain being able to contract and use all of the available muscle fibers you've got. That's why a lot of people, when they try bodybuilding or lifting weights, for the first 6 months they'll get really, really strong. They might even look a little bit different because their tissue is holding more water, body fat's starting to be burned off. But in reality, in the first 6 months, they haven't put pretty much any muscle on. It's just their brains adapting and being able to connect to the tissue and contract it harder for longer. What happens is after 6 months of doing that, people plateau off and find it really hard to add more weight onto their exercises. But the next couple of weeks, you're going to have a lot of neural adaptation, because the thing is, it doesn't matter how much muscle mass you've got on your legs or in your ankles. That really doesn't matter. You already have enough tissue to be able to control the joint. But at the minute, the brain doesn't have a very good idea of where that joint is. But once it starts to know where the joint is, it's going to help to start stabilize a bit. We've also got a twofold part either, because it means that by exercising the muscles and fatiguing them out, it means they're going to be a little bit sore through the micro traumas and the nerves and how your spinal cord works, which means they're constantly going to be firing signals to your brain to let your brain know the state of the tissue, which is good because it lets your brain kind of remap your body system and start to understand where the joint is. So let's get those 20 reps done on the other side and then jump straight into the next exercise. Okay, so the next exercise is still having ankle involvement, still having knee involvement, but it's really meant for the hips to help stabilize them up a little bit. So, going to assume your position. Remember, big toe on the left foot, we'll start on the left hand side. Adam likes the left side. Pushing into the floor, 78% of the weight to the left leg, knee bent ever so slightly on the left leg. Right leg straight, right hip lifted up. You're going to hold it. And what we're going to do is in this position, we're just going to hike that. And then we're going to come down. You're going to let your foot tap the floor on each hike. Boom. If you are insanely hypermobile, try not to go to the total end range so you end up like this. Just go up just about the same height as head is doing. So hip hikes, we are doing anywhere between 30 to 60 please. I really like high reps, as you're going to find out in the next few weeks. Heather already knows it, that's why you can see the kind of foreboding look on her face, so she knows what's coming. But get those reps done. Right side, so on the left side, so you'll feel it burning through the left hand hip, totally normal guys. And then we're going to relax, and we're going to do the other side. Once we get them done, on to the next exercise. Okay, final exercise. I can hear people at home saying, thank you, God, thank you for that. Good. Nearly done for today. So we're going to assume the position, and I'm going to turn header sideways on so you can see it a little bit better. So start on the left, big toe pushes in, 78% of the weight to the left leg, creates a nice arch in the foot. left knee is going to bend ever so slightly, right leg straightens, right hip comes up into a hike, she's going to hold it. We're not going full hike, we're just getting enough to get half an inch off the floor from your foot touching it, okay? Now, this is the important bit. Lock your head with your ankle, so you want to be in a straight line. And what you're going to do is you're just going to very gently pivot forward. So see how head is still in line with the foot. She's going to hold, so don't go too crazy. We want just about this angle. And then what she's going to do is, as she bends the left leg a little bit, she's going to let her head go forward a bit more. Hold. Good. And she's going to hold this position. Try not to let your hips rotate. Try not to let your hip drop. Try and keep the hips nice and level. Head in line with the foot, nice straight line. And we're just going to hold it. And this is what we call an isometric exercise. So remember, nice painkilling effect from isometrics. So we're going to use this to finish our session off today. So we're going to hold it into this position. And what I want you to do is to do as long as you can do. Okay? So that might be 30 seconds, might be a minute, hey, might even be 3 minutes. But get to the point where this left hip, left ankle, knee, calf is really starting to burn, and then try and just push through for a little bit longer, 10, 20 seconds, then relax. Relax, Heather. Good, perfect. Thank you, Heather. We will see you next session. Well done, guys. Any questions? Please drop me a line, let me know how you're getting on. Cool. See you soon.